An estimate of 180,000 deaths in a year are caused by burns. The vast majority occurs in the low and middle class income countries. Today, in Health Matters, we're going to discuss burns.
Naitwa Catherine Wangui.
Catherine, kwa nini leo uko hapa? Nini kilitokea?
Mtoto ndiye alichomeka.
Nini kitu gani yani kilimfanya yani? Nini ilimchoma?
Maji moto ikiwa kwa jiko.
Ikiwa kwa jiko? Yani na wewe ulikuwa kwa wapi wakati huo? Yani tueleze.
Nilikuwa kazini.
Alafu
msichana wa kazi ndiye aliniambia mtoto ameungua.
Maji ikiwa alikuwa anacheza ama?
Alikuwa ameamka asubuhi. Akaenda akapanda juu ya kiti.
Alafu
ndiye akateleza akaanguka.
Akateleza akaangukia maji. Na vile aliungua, msichana wa kazi alifanya nini kitu cha kwanza?
Aliniambia amemtoa nguo, alafu akampeleka Nairobi Health Center.
Akampeleka
Nairobi Health Center. Akafanyiwa dressing, then akalifaliwa huko.
Alafu umeambiwa hii kuungua yake imefika stage gani? Iko degree gani?
Ilikuwa second degree deep burn.
Anaitwa Beatrice Wangui. Kwa miaka 2 na miezi 7. Nimebuka ya shai. Ya shai. Alafu nikamtoa manguo, nikamfanyia first aid, nikamwagilia unga ngano. Akakuja hospitali kwa aso huko.
Na vile ulimwagilia unga ngano uliona kai inasaidia?
Mshungu iliisha.
Hiyo unga ngano ulitoa wapi? Ni kitu umekuwa nayo yani ukiwa na wazazi wako wanafanya ama ni majirani? Ulijulia wapi hiyo nini ya unga ngano?
Unga ngano ndio na shosho mweke.
Inamalizia uchungu. Alafu
tukakuja huko hospitali kwa aso.
Na leo ni siku ngapi yeye kwa hapa?
3.
Siku ya 3. Na degree yake ya kuungua iko 4 degrees. Today we are joined by Dr. Shahaban Saidi, who's a plastic and reconstructive surgeon. Assalamu alaikum.
Wa alaikum salam.
Thank you for joining us today.
Thank you, it's a pleasure.
Okay. In the topic of burns, maybe you could just start by telling us what is burns? What are burns? Sorry.
Burns are just injury to the skin. Injury to the skin caused by agents that will damage the skin. As we know, the skin is what covers the body, what gives us protection. So what can cause what we call trauma to the skin or damage to the skin? Biggest being burns, mainly caused by fire, what we call dry flame. Then there's what we call wet flame, or what we call scalds, because like hot water, hot oil. Then the other causes which can cause burns, like chemicals. People who work in industries, they get chemicals which can cause burns. Then people who work with things like X-ray or radiation, those can cause burns. And also cold. Some people work in extreme cold, in extreme temperatures, also those can cause burns. Yeah, those are the ones which are damaging the skin, going into the skin. We call them now causing burns.
Okay, and how many types of burns do we have?
Burns, you can classify them in many ways. You can say they are severe burns or non-severe burns. Or we can grade them into grades. Grade 1, grade 2, grade 3, or grade 4. Depending on how much the skin is affected. The skin has deepness. We have the upper part, we call the epidermis, the inner part we call the dermis. So how much it has penetrated into the skin, now we say it's grade 1, or grade 2, or grade 3, or grade 4. For example, when you say grade 1 burns or first degree burns, it's just like sunburn. The way a child will get sunburn, or you are going to the beach and you get that's what you call first degree. Then you get second degree, which we can say it's a superficial burn or a deep burn. Superficial burn is upper part of the skin, meaning you have not damaged the inner part of the skin, the things that help the body heal. So we call it a second degree superficial. Then there's something we call second degree deep burn. That one has gone a little bit deep. It has damaged these cells that will help the skin heal on its own. So that's a second degree deep. Then when it goes a bit deeper than the skin, you burn the muscle. We call it a third degree burn because there's a muscle underneath the skin. Then they can go further down and burn the bone. We call it a fourth degree, which we see. So it's first degree, second degree, third degree, fourth degree. That is according to depth. Then when patients also come, we also want to know how big is the burn. We call it the percentage burns. For example, what we use as to say how big the burn is the palm of your hand. We say the palm of your hand is 1%. So if you have been burnt here, we just calculate how many palms, like 6%, 7%. Now, for children, anything above 10% we say is severe burns. For adult, anything above 15% is severe burns. So that's how we grade burns.
And what are the home remedies for first degree burns?
Now, very important in burns when you get home. When anybody gets a burn, the treatment for fire is water, not anything else. Let water run down the burn. Put it under the tap, let it cool down. It does two things. It reduces the pain, and the second thing, it reduces the effect of the burning. So the pain goes down and the burning also stops so that it doesn't spread. That is actually the only first aid I can tell you about burns. We all come from different communities, you know what we do in our community. Some people apply oil, some people apply toothpaste, some people apply gun oil. The worst I've seen, I've worked in Turkana. When you get burnt, they slaughter a goat and everything, the contents of the intestine is poured on the burn. All those are used as first aid. Remember, the burn needs to breathe and cool down. When you cover it with anything else like oil, like urine, like what, you're covering that. It's not breathing. It is not airing. So the burning process may continue and the pain continues and the damage continues. So if you can stick to only water, it will be good enough.
Okay. And is there a substitute of water?
Now, I think God created water everywhere. That is one thing you can find anywhere. You'd better actually leave it alone and rush the patient to the hospital than use any other thing apart from water. Damaged skin, you have lost the protection. So anything else that you are using on top of that, you don't know what it's going to cause inside there. That's why we like to say don't use anything else but water. Luckily, alhamdulillah, there's water everywhere.
And just any type of water or specific type of water?
The best water is usually tap water. When you can open the tap and let it run. If there's no tap near, take a water in a jug or a cup and pour it into the burn. Let it drip down, let it pour down. As it goes down, it's cooling the burn. Avoid something like seawater. Seawater is heavy water. It has salt. It is heavy water. It will not give. If worst comes to the worst, you just have seawater. Use seawater. But the most important thing, the water must be cool, not warm, not lukewarm. Must be cool.
And can you use ice also?
Now we actually, ice causes more damage than actually good. Yeah, because what happens to ice, you come from, if you've taken tea, hot tea, then suddenly you take a very cold drink. What do you feel in the mouth? You feel actually pain. It becomes sensitive. What happens when you move straight from one temperature to another temperature? You actually cause damage to the cells. Actually, ice damages cells. That's why we like to avoid ice. Make the ice melt, get some water. In fact, the good water is the tap water, that temperature. In fact, not water from the fridge. Now, normal room temperature water.
And how long does it take for a burn to heal?
We have described two things: the depth of the burn and the extent of the burn. First degree burns, like the sunburn, we expect it to eat 5 and 7 days. 5 to 7 days, it's good. Second degree superficial, just below the skin, we expect it to hit in 2 to 3 weeks. That is 14 to 21 days. Third degree and below, it depends on many things, because now you have to help that burn. It will not heal on its own. You have damaged the cells in the skin that will come and regenerate new skin. So what you need to help that burn, that's how patients stay for a very long time in the hospital. When you see them, they have stayed for 1 year, 6 months. Those are third degree, fourth degree burns, second degree deep burns. So those ones you cannot predict, you cannot give it a time frame of how long they will heal.
And do burns heal quickly when covered or uncovered?
There are what we call it in our surgery, we call it schools of thoughts. There's what you call the open method or exposure method, or the closed method. Both of them do very well depending on circumstances. If I was treating a burn in Mombasa or Garissa, I will actually use the open method. I will leave it exposed. The temperature is good, the temperature is warm, we will just be applying medicine. But if I treat it in Nyeri, in Nairobi, I will most likely use the closed method. The temperature is low. You can imagine a baby comes with a burn maybe 30%. Then I don't cover the burn. I'm just applying cream. It's as cold as we are. So I'm going to kill the child from pneumonia, not the burn. So it really depends on the circumstances. Both methods work very well, but it depends on what circumstances you're using the method.
And with the open type, is it not dangerous because there's bacteria and a lot of things? Is it not dangerous, and yet it's a wound and it's open? How do you tackle that?
Okay, when we decide to treat by open method, we do what we call open sterile method. If you come to our wards, there's something like a dome on top of the patient. We call it a cradle. First of all, when you decide to do open method, every day we go to theater, we get sterile sheets. The patient lies on the sterile sheet. If it's the hand lies on the sterile sheet. Then we apply some medicine on top of it. Then we cover with this cradle to try and protect it from the environment. You are actually right. Because of the bacteria, sometimes the world actually is moving away from the open method. Because of now the bacteria, you see in the wards we have wounds and we have other things. But if you are nursing a patient only in the ward, only in the room, you can actually use open method. But because of many other issues, people are moving from open methods to closed method now of managing burns.
Okay, and then you talked about sunburns.
Yes.
What is the first thing to do if you have a sunburn?
Sunburn, all first aid of all burns, whether it's sunburn, whether it's fire, whether it's water, whether it's chemical, whether it's electricity, whatever, the first aid is water. The first aid is water. The most important thing in a sunburn is protection before. If you think you're going to the sun, use a sunscreen. Sunburn occurs mainly in children who are exposed. To us, the temperature of the sun may not be very hot, but to a baby is very hot. So what we tell parents, from 11 o'clock, don't keep your baby outside. The temperatures are too high. Before 11 o'clock, the temperature is not very high. The children can bask in the sun. The babies can bask in the sun. But in a nutshell, all burns, the first aid is water.
And then there's a burn, I don't know how it's classified. When the baby gets a burn from nappy, yes, overstaying with the nappy or the pamper, the diaper.
Yes.
Yes. How do you classify that type of burn, and how is it treatable or managed?
That's actually a form of chemical burn. When we were talking earlier, I told you some chemicals can cause burns. The diaper contains urine. Urine contains a chemical called urea. So what the urea does, actually urea burns the skin. Yeah. Even stool, the baby's stool contains chemicals. Is that actually that chemical, the exposure of the chemical to the skin of the baby that causes the burns? Usually it starts as a superficial burn like a first degree, but it can go into second degrees. You've seen babies having very, very deep burns because of just the nappy. We call it the nappy rash, but it can go into a deep burn. Most important thing, keep it clean. Keep it very clean. Now that is an area we do by exposure method. Now we don't close. Every day we clean the child with water. Avoid putting on nappies or diapers until the wounds have healed. Yeah, so this a child you'll cover on top to make sure they don't get cold, but underneath here they are not having anything.
And after using water and all the first aids, what's the best ointment for a burn?
Now, the most important component that have been seen to be used in burns is something we call silver. So silver comes in many preparations. There is the commonest available, we call it silver sulfadiazine. Yeah, it goes by many names depending on the company, but it's a silver cream. It's a silver cream you apply it on a daily basis. For example, this child who has had a nappy rash, after I clean nicely daily, I'll take the silver cream and apply it on the baby nicely. Okay? When the baby passes urine and like clears that part, I'll just take more silver and apply on it. So silver is actually the most important chemical used in burns. If you go to bigger hospital, bigger areas, you use advanced dressing methods. But what do? They actually contain silver also. So silver is the main agent that is used to manage burns. So if you have burns and you buy a silver cream, just say silver cream, you'll get a good white cream that you can apply on burns.
Okay, so these aloe vera, all things, they don't work?
They don't work.
Olive oil?
In the world today, too much research has been done about burns. They have tried many other things, including the aloe vera and whatever. They don't work. Where does aloe vera, oil and olive oil work? They work after the burn has healed, when it's starting to form a scar. They are very good in preventive scarring. When the burn now has passed the healing process, now it is starting to form a scar, they can massage now the aloe vera, the olive oil. It is very good in preventing of the scars.
And when someone gets burnt at home, when do you know this one needs hospital and this one just needs my home remedies?
Usually our advice as surgeons who treat burns, let a doctor see all the burns. Let the doctor decide, this is not serious enough, go back home. This is serious, let's stay with it. Why? Because some burns may look very innocent. I've seen it. You see it's just a small thing up here, but you don't know it has penetrated deep. It comes back now after 2-3 days. You see, the most very important time in managing burns is the first 24 hours. If you don't take it nicely the first 24 hours, it is likely to complicate. So come to the hospital after the first aid, go to the hospital, let the doctor look at it and say, no, this is not a serious burn, go back home. Then go back home. Don't take it for granted. So my message is, take all burns to a doctor. Let them see it, then say, this is not serious. Why? Because we see a big complications of burns. For those who have just said, ilikuwa kitu kidogo. Yeah. So always take them seriously.
And during your career, which are the frequent burns you've tackled, or which are the frequent burns that you see on daily basis?
To give you some statistics, first of all, 60% of burns occur in children. Yes. And children, the biggest cause of burns is water. You just turn your head slightly and you're with a child, and the child will be inside the water. So those are accidents we get. So those are the most common burns, and they can be very severe. Some can even go up to 80% of the children. Yesterday we referred to children who had more than 50% of burns. Yeah, so those are the most frequent are children and hot water and hot tea. Those are the most frequent. Followed by in adults, the adults don't get really burnt. It's usually by accident. But the people who are called epileptics, kifafa, those people, we have them and they get very severe burn. It's a mama, she's epileptic, she's cooking, then she gets a fit. She gets a fit now, her foot goes into the jiko. She's not aware. She starts burning her foot. So we have that, epileptics. Elderly, very old people, they like going next to the fire. What happens now, most of this fire is charcoal. They breathe some of these things and they lose consciousness. They go into the fire. Unfortunately, we lost one old lady yesterday because of such burns. So those are the most common burns we actually see around here. Very rarely we see chemical burns here.
And how do you diagnose the burns?
The most important thing in a burns is what we call the history. They will tell you that the mother will tell you, my child was reaching up for tea, which was on the table. So the most important thing is the history, what you get from the mother. The second thing now is when you look at it initially, we quickly classify it because of its characteristics. First degree burn is straightforward, but you'll get some burns having blisters, things like blisters. A burn that has blisters, that is a second degree superficial burn. So we will diagnose like that. Then we'll say, what is the extent? Using our hand method, we'll see how many % it is. Then we'll say, this is second degree superficial, let's say 10%, 9%. There are burns, when you look at the skin of the person, it looks like leather. Something like leather has been burnt. When you reach there, we know that it's already a third degree burn. Okay, those are the methods we use to actually diagnose the burns, how deep it is, and the extent of the burns.
About being electrocuted.
Yes.
Can you say something about that? Because someone can get burned with electricity. Yes. How does it occur, and how will someone know if they have a burn from electricity? Yeah.
Electricity is a special. What we call one of the special burns. Because electricity, it causes more damage than you see. When you have a point of electricity and you touch that point, electricity has to go through your body and go back to the ground. So that's how electricity works. That means where the burn comes out, we call it the point of entry. Where it goes out is the point of exit. It has to come out. You can imagine now, before it comes out, it has to pass through your body. It is passing through the nerves, the muscles, everything before it goes to the ground. As it goes, these things are resisting this current. As they resist this current, heat is produced. That's how you get burnt. So you will get somebody with a small burn of electricity, but he's in ICU. You wonder, this small burn, why is he in ICU? Because this current passed through the body, went to the kidney, went to the muscle, went to the nerves, and all those things got burnt inside. You're not seeing them. That's actually how electricity burns us.
And in such a case, how do you diagnose it? Do you do X-ray? Is it MRI? How do you diagnose it?
The first thing, first of all, when you find a patient burnt with the electricity, is to make sure that the electricity is off. Don't touch the patient. You'll be the next patient. So switch off the electricity, switch off the power source, bring the patient out, then look at him. A patient who's been burned by electricity is somebody who should be rushed to the hospital. Rushed to the hospital before the damage becomes too much. Now, it is very difficult to diagnose that because it takes time. How long it takes, we don't know. Sometimes, because suppose it's only the nerves that have been injured. So we keep the patient in what we call an intensive observation. Intensive observation, then we look at the urine, how it is. Because of the burning, everything is broken down, comes out through the urine. So initially, if you see somebody with an electrical burn, will have urine which is bloody, which is bad color. It looks like strong tea. So if it is like that, we know this damage is very severe. We put the patient in ICU and try and clear off the urine. Why? When the muscle is burnt, everything is burnt, they all go to the kidney and sit there. So the kidney cannot filter them. So we need to quickly clean the kidney so that it will be able to work. But if the urine is clear, we know this is not a very severe burn. Then we can manage just the wounds.
And how do burns cause death?
Death in burns is usually what we call very dramatic. You'll be having burns, I speak to you now, and within 10 minutes you're dead. That is the problem with burns sometimes. The first thing that occurs in burns is you lose fluids. You lose fluid, especially in children. Because of the burnt tissue, they lose a lot of fluid. And you can lose almost half of the fluid you have, the water you have in your body. So the biggest causes of death in burns is loss of water in our body. The second cause of death in burns is what you call inhalation burns. You can imagine if you get burnt in a closed room like this. You are breathing that air. That air is hot. It goes into the system and burns the breathing system. So when it burns, you've seen the blisters in burns. Those blisters can occur in the breathing system, and they block the breathing system. So we call it inhalation burns. The third thing that causes burn is what we call sepsis. That means the burn is too big, then it becomes too infected. It overwhelms the body. The body cannot fight about this. A lot of infection that kills patients with burns. The other thing is what we call multiple organ damage. When the burn is too much, your body cannot tolerate it. Your kidney fails, your liver fails, your heart fails. We call multiple organ failure. Okay? And the other one is just what you call anemia. When the burn is too much, you also lose a lot of blood. Okay? That can cause death. So those are the causes of death in burns.
Maybe you can tell our viewers the precautions and what to do when you have a burn and everything. Yeah.
Now,
last words.
What we normally say, prevent. Three things. Never forget. First of all, keep children out of the kitchen. Number one. Number two, try and cook from above your chest. We know we like cooking from down here. Especially if you have children, don't cook from down. Cook from up here where they cannot reach. Number three, do not leave unattended children in the house, especially when there's fire. Do not leave children unattended. Better go with them wherever they are. 50% of the children who come here with burns, the mother just stepped outside to get something. Like one mother was just stepped outside to get soap and find that the child inside the water. Don't step outside when so when you have anything burning, your eyes must be on the children. Prevent. Number two, epileptics should be kept away from the kitchen. Anybody who knows they have a problem with epilepsy, please keep them away from the kitchen. Even if they have stayed for 10 years without getting a convulsive fit. That day they enter the kitchen, they may have their fit, and that is when they'll get burned. So keep them away from the kitchen. The people who have burns, who are dealing with chemicals, whatever, they must use protection. That is important. They must use protection before they go with their chemicals. We have said when you get the burns, the first aid is usually water. There are people who get burnt. When your clothes get burnt, there are people, the mistake they do, your clothes get burnt and then you start running away crying. Don't do that. There are three things you do when your clothes get burnt. Number one, you stop. Number two, you drop. Number three, you roll. So we call it stop, drop, roll. So your clothes are on fire, stop, quickly go down and roll yourself on the ground. You will be able to kill that fire. If you run, you are giving it more oxygen.
Yeah.
It's burning more clothes. It causes more damage.
So you don't remove the clothes?
Don't remove the clothes. Usually when you when you get burnt, usually what we call it a sterile wound. You know, the fire is too hot. It has even burnt the bacteria. So if you remove it there, you'll be exposing now the burnt skin to bacteria. Let them go to the hospital, where the hospital will slowly remove it in theater, remove the burnt clothes. Don't remove it at home. Yeah.
We'll continue with the same topic next week, same day, same time. I have been your host, Naima Abdullah Hab, and this is Health Matters.